Diabetes Damages Part 2, number 1593, the 9th of April 2026, Gerald C. EclaireMD Foundation, Category Diabetes. Section 6, Personal Longitudinal Observation. My own medical history provides a useful example of the time sequence difference between macro-vascular disease and micro-vascular disease. Between age 47 and 57, I experienced 5 heart attacks. Cardiovascular disease primarily involves macro-vascular structures, particularly coronary arteries supplying the heart muscle. During that 12-year period 1991 to 2002 of my business executive life, occupational pressure was extremely high due to executive-level responsibilities, combined with 8 years of intense legal and marketing battles. Long-term psychological stress activates sympathetic nervous system responses. Body remains in a constant fight-or-flight state and increases secretion of cortisol and adrenaline stress hormones that raise blood pressure, heart rate, and glucose levels. Chronic exposure to stress responses may lead to persistent elevation of blood pressure, increased vascular constriction, increased inflammatory signaling, increased blood clotting tendency. These physiological changes may accelerate plaque formation and increase probability of plaque rupture. Therefore, long-term occupational stress may have contributed significantly to my early macrovascular disease risk. In contrast, microvascular complications appeared later in life, approximately between age 62 and 65. These later conditions included chronic kidney disease and other complications commonly associated with microvascular damage. Microvascular structures include small capillary networks supplying infiltration units, retinal tissue, peripheral nerves, and brain microcirculation. Chronic exposure to elevated glucose gradually damages these small vessels through glycation damage, thickening of basement membrane, oxidative stress, and impaired oxygen diffusion. Less oxygen reaching body tissues. These processes typically require longer cumulative exposure time before clinical symptoms become detectable. This sequence of earlier macrovascular events followed by later microvascular complications is consistent with commonly observed progression patterns in long-term metabolic disorders. Section 7, Interaction between stress and metabolic condition. Stress and metabolic disorders are not independent factors. Stress hormones increase hepatic glucose production, glucose made by the liver, reduce insulin sensitivity, elevate blood pressure variability, and disrupt sleep quality. Poor sleep further worsens glucose regulation. Therefore, stress and metabolic abnormalities interact as coupled cyst factors that amplify physiological burden. Section 8, Big Picture Mechanism. Metabolic disorders primarily damage circulation systems and cellular energy regulation. Organs most affected include heart, brain, kidney, liver, eye, nerve system. Because these organs depend heavily on stable blood supply and metabolic balance, long-term metabolic disturbance produces widespread system stress. Metabolic disorders therefore function as upstream drivers influencing multiple downstream diseases. Section 9, Important clarification. Not all mortality diseases are caused by diabetes or metabolic disorders. However, many major mortality diseases originate from metabolic disorders, which are strongly associated with overweight and obesity. This is one of the key reasons why the average lifespan in the United States is shorter than in many other developed countries. Other contributors include genetic mutations, infection, autoimmune diseases, trauma, environmental toxins, aging-related degeneration. However, metabolic abnormalities remain among the most important and modifiable risk factors influencing longevity and quality of life. Section 10, Key Message. Diabetes is not simply a sugar disease. It represents a long-term vascular and metabolic stress condition affecting multiple human organs simultaneously. Good control of glucose, blood pressure, lipids, body weight, diet control, physical activity, hydration, stress reduction, and sleep stability can significantly reduce risk of many major mortality diseases. Understanding upstream metabolic drivers provides a unified framework for interpreting multiple chronic disease pathways. Epilogue. In earlier stages of my life, I experienced professional success, recognition, financial security, and positions of responsibility. Therefore, at this stage of my life, I am no longer motivated by fame, power, or money. My primary motivation comes from having personally experienced physical burden and psychological shock associated with multiple life-threatening diseases. I do not want other patients to go through what I have already suffered. By sharing the knowledge I've learned through broad communication channels, such as YouTube, I hope I can help some patients avoid similar suffering, even if only a small number benefit. Over the past 32 years, I have experienced 5 cardiovascular episodes: chronic kidney disease, neuropathy, nerve damage, retinopathy, vessel damage, and other serious complications, including my recent stroke on June 21, 2025, all related to long-term metabolic imbalance. In particular, I suffered a hemorrhagic stroke near the pontine region of the brain, a condition associated with an extremely high mortality rate reported as high as about 80%. I survived this life-threatening event, but the experience deepened my understanding of how fragile human health can become after many years of accumulated physiological stress. To me, these conditions are not abstract medical terminology. They represent real suffering, uncertainty, pain, and fear. When a person faces the possibility of blindness, organ failure, stroke, or repeated cardiovascular events, prevention becomes deeply personal and urgent. My goal is simple: to share what I have learned so that others may better understand the mechanisms of chronic disease and reduce the probability of experiencing similar suffering. If clearer understanding of lifestyle details, metabolic control, and early warning indicators can help even a small number of individuals avoid the complications that I have faced, then the effort devoted to this medical study S&D research work over 17 years will have meaningful value. Disclaimer: I write this paper not for fame, but to share what I have learned so others can better understand their health, prevent disease, and live longer, healthier lives. This content is for educational reference only and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights belong to Gerald C. This content is provided for educational reference only and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article and its related materials belong to the author, Gerald C.